Most people believe that when the heart is in serious trouble, it always sends a dramatic warning. Crushing chest pain, a sudden collapse, an emergency room visit. But after more than 25 years of caring for heart patients, I can tell you that reality is often very different. Here's what nobody tells you. The heart frequently whispers before it screams. The earliest warning signs are often so small and so ordinary that people dismiss them completely. A little extra fatigue, slight shortness of breath, a strange sensation that comes and goes. Nothing alarming, nothing urgent. At least, that's what many people think. Yet those tiny symptoms can sometimes be the body's earliest attempt to warn us that something important is happening. And that is exactly why today's topic matters. Because one small symptom, ignored for weeks or months, can sometimes be the difference between early treatment and a serious heart problem that changes a person's life forever. My name is Dr. James Carter, and I am a cardiologist with more than 25 years of experience caring for patients with heart disease. Throughout my career, I have met thousands of people who assumed that serious heart problems always arrive suddenly and without warning. What I have discovered is that many patients didn't ignore severe symptoms. They ignored mild ones. Symptoms that seemed harmless. Symptoms they blamed on aging, stress, poor sleep, or simply having a busy life. Time and time again, I have seen how recognizing those subtle signs early can dramatically improve a person's outcome. That's why I wanted to share this topic with you today. Before we discuss the warning signs themselves, it's important to understand how the heart works. Think of your heart as the engine that powers your entire body. Every organ, every muscle, and every cell depends on a steady flow of oxygen-rich blood. When the heart begins to struggle, even slightly, the effects can show up almost anywhere, not just in the chest. They can affect your breathing, your energy levels, your legs, your sleep, and even your ability to perform everyday tasks. The challenge is that heart disease usually develops slowly. It doesn't happen overnight. The body often sends small signals long before a major event occurs. The question is whether we recognize those signals when they appear. One of the most commonly ignored symptoms is unusual fatigue. Many people assume that feeling tired is simply a normal part of getting older. And to be fair, fatigue can have many causes. Poor sleep, stress, medications, and lifestyle changes can all play a role. But sometimes, fatigue is the heart's way of telling us that it is working harder than it should. When the heart cannot pump blood efficiently, the body's tissues receive less oxygen. Everyday activities suddenly feel more demanding. Climbing stairs becomes difficult. Carrying groceries feels exhausting. Taking a walk requires more effort than before. I remember a patient in her 70s who came to see me because she simply couldn't understand why she felt so tired all the time. She wasn't experiencing chest pain or any dramatic symptoms. She just felt exhausted. Further testing revealed significant blockages in several coronary arteries. She was shocked. She never imagined that fatigue could be related to her heart. Have you ever experienced a change in your energy level that didn't seem to have a clear explanation? Another symptom that many people overlook is shortness of breath. As we age, it is easy to assume that becoming winded more easily is simply part of getting older. Many people blame their fitness level, their weight, or a lack of exercise. While those factors can certainly contribute, subtle breathing changes should never be ignored. When the heart struggles to pump effectively, fluid can begin accumulating in places where it doesn't belong, including the lungs. This can make breathing more difficult, especially during physical activity. I once cared for a gentleman who told me he had started sleeping with 3 pillows instead of 1. He thought it was simply more comfortable. What he didn't realize was that his heart was struggling, causing fluid to back up into his lungs whenever he lay flat. What seemed like a minor adjustment in his sleeping habits turned out to be an important clue. Have you noticed yourself becoming breathless during activities that once felt easy? Chest discomfort is another warning sign that often goes unnoticed because it doesn't always look the way people expect. Many individuals believe heart problems always cause severe pain. In reality, heart-related symptoms can feel surprisingly mild. Some people describe pressure, tightness, heaviness, or a squeezing sensation rather than pain. Others mistake it for indigestion or stress, and sometimes it truly is something harmless. But reduced blood flow to the heart muscle often causes discomfort long before a heart attack occurs. It is the body's way of asking for attention. I have had patients tell me it felt like someone was sitting lightly on their chest. Others described it as an uncomfortable pressure that came and went. The important lesson is that heart symptoms are not always dramatic. Were you aware that serious heart problems can sometimes present with little more than mild chest pressure? Swelling in the feet and ankles is another symptom that many adults dismiss. It often develops gradually, making it easy to overlook. Shoes may feel tighter. Socks may leave deeper marks. Ankles may appear puffy at the end of the day. Many people assume the cause is standing too long, warm weather, or simple aging. While those explanations are possible, persistent swelling can also be a sign that the heart is struggling to circulate blood effectively. When blood flow slows down, fluid can begin collecting in the lower parts of the body. One of my patients believed his swollen ankles were related to arthritis. During his evaluation, we discovered early-stage heart failure. Fortunately, because he sought medical attention before severe symptoms developed, we were able to begin treatment early. Have you ever noticed swelling that seemed unusual or lasted longer than expected? Perhaps one of the most overlooked warning signs is an irregular heartbeat. Many people occasionally feel their heart race or skip a beat. Stress, caffeine, excitement, and even dehydration can cause temporary changes. However, recurring episodes deserve attention, especially after age 60. Some patients describe the sensation as a fluttering in the chest. Others say it feels like a vibration or a brief period when their heart seems out of rhythm. Certain abnormal heart rhythms can increase the risk of stroke, heart failure, and other serious complications. I remember one patient who described the feeling as a bird flapping its wings inside his chest. He ignored it for months because it wasn't painful. Eventually, testing revealed a significant rhythm disorder that required treatment. Once treated, his symptoms improved dramatically. Have you ever experienced a sensation like that and wondered whether it was important? This brings me to a story that perfectly illustrates today's message. Several years ago, I cared for a man named Robert. Robert was 68 years old, active, independent, and still working part-time. His only complaint was occasional fatigue. Nothing severe, no chest pain, no dramatic symptoms, just a little more tired than usual. His wife repeatedly encouraged him to get checked, but he felt fine overall and assumed he was simply getting older. Weeks turned into months. The fatigue slowly worsened. Then, one afternoon, while walking a short distance, he became severely short of breath. Further testing revealed advanced coronary artery disease and significant weakening of his heart muscle. The symptom he had ignored for months had been his heart's earliest warning signal. Fortunately, treatment helped him recover, but his journey was far more difficult than it might have been had he sought help sooner. The good news is that not every story ends with a crisis. I also remember a woman in her early 70s who noticed that her daily walks were becoming slightly more difficult. She wasn't experiencing severe symptoms, she simply felt more breathless than usual. Instead of ignoring the change, she scheduled an appointment. Testing revealed an early heart condition that was highly treatable. Because it was caught early, her treatment was straightforward. She made a few lifestyle changes, adjusted some medications, and continued her regular medical follow-ups. Today, she remains active, independent, and healthy. Her story reminds us that early action often leads to better outcomes. If there is one lesson I hope you take away from today's discussion, it is this. Serious heart problems often begin with small symptoms. Not every symptom means something is wrong, but every persistent symptom deserves attention. Awareness changes outcomes. Small changes in energy, breathing, swelling, chest sensations, or heart rhythm may seem insignificant, yet they can sometimes provide valuable clues about what is happening inside the body. The goal is not to live in fear. The goal is to stay informed, pay attention to your body's signals, and seek medical advice when something doesn't feel right. As we conclude, I encourage you to think about your own health. Have you noticed changes in your stamina? Do you become short of breath more easily than before? Have you dismissed symptoms simply because they seemed minor? The habits we stop questioning often shape our future health. By staying curious and proactive, you give yourself the best chance of protecting your heart for years to come. I'd also love to hear from you in the comments. Have you ever experienced a symptom that seemed small but turned out to be important? Your story could help someone else recognize a warning sign they might otherwise ignore. And if you found this video helpful, consider sharing it with a friend or family member who may benefit from this information. Sometimes one conversation can make all the difference.